drug test at Health South? Did you get a
Well,
copy of
I
that?
took it before I went to Health South.
And you have your personal copy. You have a copy yourself.
If I don't, I can get another one.
Okay, you go ahead and get that and that will cover
Are they
you.
gonna want it within the last 30 days?
No,
though?
no, I talked to her, it's within the, being in the, being, in school.
Oh,
Okay.
So, will my background check or whatever I started the program work
Yes.
also?
Yes,
Oh, yay.
I believe it will.
Okay.
Felicia and McAllister, they really, probably a flu shot, I believe. And that's probably true too for you, Tammy. Miranda, I'm in the process of getting a hold of Restore. They like you to send all your stuff early, and so they've got a new person, so I'll get with you on, Legacy. Courtney, no, nothing, she just wants you to have a TV, you'll be fine with that. Brittany, there's nothing extra for PTE. For Sienna Hills, Jessica on Health South, I have a form for you to fill out, and then we'll send that in, and then she'll make contact with you, that's how they've been doing that. Jay, total rehab is freestanding. Scott on Mina, what did you have to have, Jade, anything extra? Flu shot.
They didn't even know that I took it.
Okay, make sure you have a copy of your flu shot in your, book. And so other than that, I think we're okay. Tammy, we talked about your flu shot. Okay. It'll be easier this time, huh? We are on chapter 3 in medical office management. I do need y'all to send up your home evaluation so I can look at those. Did anybody have any comments on those? Was that interesting, or did you have a good time, or was it,
They
did you
never
learn
make it,
something? Huh?
they never make it in my house.
They'd never make it in your house, you'd have to.
Well,
do it if you-
they could probably get in, it's just a 3-inch little like brick step, you know?
Uh-huh.
So if they're able at all, they can get in. But
That's pretty easy to put a ramp right up, you know, a little short ramp
as soon
there.
as you get in, there's a table right there at the lamps, and everywhere you turn, there's stuff in the
Well,
way.
you'd have to move furniture out.
Yeah, and then our bathroom's like 21-inch doors or something, you know?
Like I did it, but
Some of them don't apply, so if you don't, it's fine.
and I didn't write like a comment or anything.
On the back, did y'all put, I do need you to put anything that you use for equipment or anything like
Yeah,
that.
I like
Okay,
that.
then you're,
I just didn't like write it.
but you're probably all right. Pardon? Yeah, you can bring it to me. You guys, on your tilt table, when you get those done, I need you to turn those in, because I do put credit down in your engraving. So make sure you turn in your tilt table sheet once it's done.
Where do you want us to put it in?
You can put it in my box, I don't have a box, but you can just bring it to me.
This is tilt table.
Okay, I'll take it. I mean, I can take it right now, if you got it. You've already done it. Did anybody get sick on the tilt table? Did y'all take anybody straight up and straight down? That'll do it to them, trust me.
Oh, I'm proud all today.
Okay. No, I mean, seriously, it really will. If you go all, well, the electric ones are worse, because you just go straight up. Yeah, he's sick, you don't want to do that.
I drank sour milk this morning. Here's the deal, you know, I don't hang with you.
I didn't write down
Just
this.
do. Stop it. It was already, by the time I tasted it,
You write it on here?
I didn't write it on the
So I'm
vital
rolling.
signs. I wrote everything else.
I got it in my mouth. Huh?
Okay.
I was like, oh, I'm just looking.
This is going on with the legal system today. And this is, of course, for all, not just the physician, but for everybody. We talked about this a little bit, Board of Supervision and Medical Licensure. We've talked about the difficulty in Oklahoma, and the reason is everybody is licensed under this except nursing. And so what happens is you are a very unimportant person, because your doctors are licensed under this, all your respiratory therapists, all your therapies are licensed under this place. It's gotten better. They've actually had so many complaints that the legislature has given them some more money, and so, it's gotten better, but with the state of Oklahoma, they don't care about you at all. And if they lose papers, they don't care about you. So you always, if you're gonna go ahead and apply in Oklahoma, you need to check on it, make sure it's complete, everything has to be in order. They don't give an inch for you, okay? So just be aware of that. Some states are that way. Arkansas Physical Therapy almost bends over backwards to help you. They'll call you and tell you they're missing something. I mean, they're still that way. But they're on board, and so they're only taking care of, you know, 200 or 300 people versus however many.
Is it easier since, like, living in Arkansas to get to Arkansas, because I was going both, to get Arkansas and then apply for Oklahoma?
Definitely.
Okay.
And I think there's some new rules about if you live in Oklahoma, going through the Arkansas State Board first, so I don't know. I
Yeah.
can't remember
I
exactly.
think
Bill
we
thinks
can't, test early for the Arkansas.
You can't test
license.
early.
Yeah.
Yeah. Because he said Missouri ruined it for everybody, because people was coming from Missouri to Arkansas and testing early or something. Ain't that what he said?
Oh, that's too bad, because most Missouri people, well, I don't know. Okay, so if you're gonna test early, you're still gonna have to go through Oklahoma if you live in Oklahoma, is that what you're saying?
I
So if
believe
you're
that's
planning
what-
on testing in July,
I say I moved in with you.
you'll have to
You
do
need
that.
my address. We
Okay.
have 19 people living in my house for a month.
And changing their, how many of you are Oklahoma people?
I know it smells something.
So there's quite a few that are gonna have to do that if you wanna test in July, and I want you to test in
I'm pretty-
July,
I'm
so
pretty
y'all need to
kicked
go
off
through
about it.
Oklahoma. Because I would like for y'all to do that, it's just better if you can. If you pass your license, if you pass your exit exam, we allow you to test in July.
Is it at the beginning of July or the
It's around,
twenty-fourth?
it's about the middle of it. We had about a week, about the 24th probably, we had a week left, a week and a half left after they tested, so it was like the 4th week of the clinical rotation, so it will be around,
I got online and looked at the testing dates, and I think it's like July 8th.
July 8th, so they moved it up. That's interesting. So July 8th is when we're gonna do it. Well, that'll actually be better because there'll be some time at the end of that clinical. The hardest thing for you guys to do is once you pass that test, you're gonna want that little, and you still have 2.5 more weeks of clinicals.
Yeah.
And I have not had good experience with that, to a point that I almost don't wanna let you take it, but I don't want you to have to wait another 3 months. So please don't
You
let
shouldn't wait next
down,
year,
you
Stacy.
still got 2.5 more weeks of clinicals, you have to still pass that class. I could keep you from passing, I could keep you from being licensed even though you have your license. Would I do that? I might if you did something really bad.
Once we pass our test, then we have to apply for the license. Okay.
And you who are in Oklahoma, well, all of you probably need to start thinking about getting that going. You could apply now and put in for that. You could go ahead and pull out your application packet. Oklahoma requires you to have a doctor sign off that you're medically well. Everything has to be, what is it called? Someone has to prove that you notarized. Everything has to be notarized in Oklahoma. So go ahead and get that going. I would encourage you to pull your application packets off of your licensure board and kind of look at it and start looking at it. You're looking at about $650. You realize that? So you need to go ahead and get that signed on.
Yeah.
Pardon? Brittany's paying for it? Okay. So anyway, go ahead and kind of get moving on that because then you'll at least have start to get it in your mind. In the state of Oklahoma, if you're testing in July, everything has to, and they're very sticklers. If you miss it a day, you don't get to test. So that's what I'm telling you. Oklahoma's not gonna give you an inch.
And the next test is until like October.
Yeah, it's in October, it's every 3 months. You know what happened is there were physical therapists who were cheating. Students that were cheating and sharing questions and things like that. And so when I took my test, I took a course. It was a good thing that actually were asked about, which was interesting. I worked in a rehab and there's a lot of spinal cord questions. I just worked with 2 or 3 spinal cords that really helped me to do that. But it just helps to get it taken as quickly as possible, my thought on it. Not to mention that you want to start getting paid as soon as you need a job. You don't need to wait 3 months for that. So, if you're dealing with some type of a complaint issue, complaints can come from other peers, patients, employees, including hospital employees, the media, and insurance companies. I've dealt with one student that was complained about in the state of Arkansas, and what it ended up being, which this student was this way, she started running around with her PT's boyfriend. And so this PT turned her in.
How smart.
And, you know, there are some things that you should not do in your life. If you are, let's use common sense here, okay? Let's use common sense. And she's a good PTA, but she didn't have a lot of common sense. So it worked out, it came out, you know what had happened, but it was a pain. She had to go before the board, she had to present her case, she could have lost her license. So, you know, there are just some things we shouldn't do. And the PT was probably reprimanded for what she did.
Yeah,
I would
that's
hope
more of a
she was reprimanded.
personal thing.
But you don't let personal things in. Remember, you don't date or have anything to do with anyone in your clinical until you're way out of my program. I dealt with it 2 years ago. I will drop you in a minute now. It causes me lots of problems. So do not date, do not even, yeah, and for sure not with patients. You absolutely cannot fraternize with a patient at all, even if you are not treating them. You cannot fraternize with patients until you are out of my program. I mean, you get connected with people. I'm not saying that. I'm just saying as a student, you can't do that. But for sure, don't date anybody in the hospital or anything. Don't have anything to do with anybody like that. If you feel anything romantic coming on, you flee. Flee from temptation. It just causes me lots of problems, and I'm not at a point now that I'm going to give much, okay? So just be careful. I know most of y'all are married, so just remember that. Most of you are married. Yes. Some of them I've had to help stay married over the years. Stay married, you know. Okay. The national license exam for physical therapist assistant. Remember that once you take that national exam, it's good forever. Once you've been licensed and you passed your exam, it's good in every state. Used to, that was not the case. They had different standards in different states. And that was a pain. So,
You have to retest?
no, you won't have to retest. They'll make you go and usually do a lot of continuing education and even sometimes work under supervision.
Okay.
My advice is, once you get that PTA degree, I would never let it go. I don't care if you never plan on doing it again. Keep up your you guys don't have a lot of continuing ed to do. State of Arkansas, you do 10 hours. State of Oklahoma is a lot. You might get your Arkansas license, and you can actually put your license on an active in different states. And if you keep your it active in Arkansas, then they're going to just reactivate you if you want your license back. There's some different things in different states to do that, but you just don't ever want to let it lapse. I mean, especially, I've had females that did it because they raised their kids for 10 years, and you just never know what's going to happen down the road. So once you get licensed, don't let it go ever.
How does that work for like travelers, where you're licensed in one state and you travel to other states?
Normally, your traveling company will take care of that for you and get that going as quick as possible. They know how to get around that very quickly, and they call the board, and they get you licensed quickly. So they're good at doing that.
It'd be good if they had a national license, wouldn't it?
It would, but
Be like,
again, your licensure is at the local level. The problem, I don't like giving big government control of anything, so I'd rather it be at the local level. I'm kind of that way. Let's keep it at the state level. Well, Oklahoma's very stringent with physical therapy laws. Now, they used to not be, but some of these states are even more stringent. So we don't want more supervision. I mean, some states are very stringent. Oh, except, the only time you don't work for them, Indian services, you can work in different Indian services and not get another license. As long as you're already licensed in the state, in the United States, then you don't have to do that. VA hospitals are that way, public health and military bases. So as long as you have an active state license somewhere, you don't have to have another, you don't have to go from state to state and get your license. Unless you're gonna treat off, like off the military base. Let's say you move to Virginia and you still have an Oklahoma license, but you're working at the military base. If you do any kind of treatment at all, even family or anything, you need to probably get that, from state to state. There, if you have to apply for your license, they're gonna grant that to you. You've already tested, you just have to jump through all the hoops and pay your money, right? Pay your money's the biggie. Sometimes you're gonna see RPTA or RPT, LPT versus PTA. I personally still a lot of times put LPT after my name. When we first changed that, I was just putting PT down. I actually had a man come up to me and say, why would you wanna not be people to know that you were licensed? He said, PT doesn't look official enough, you know, and so I don't know, I've kind of done LPT, but of course I'm an old person and I did that all for years and years. RPT is a registered physical therapist, and that was what Oklahoma had before. There are still some people my age and older who still use RPT. That is acceptable. So when you see that, PTA is that. But it is very legal for you to sign your name. Right now you're putting SPTA, but once you... every year you have to renew. I just paid mine this weekend. Arkansas is $50 now and Oklahoma's $60, so that's not too bad. I've talked to y'all about also liability insurance. Even if you're covered by your facility, I would still get liability insurance, and it runs about $85 for y'all. You know, if you're a PRN person, which is what you would get it for, and I would recommend that you do that. In the state of Oklahoma and Arkansas, what you have to do is get continuing education units, and one unit is worth 10 hours. So basically in Arkansas, you have to have 10 hours of continuing education, and in Oklahoma, you have to have 30 hours every 2 years. So Arkansas doesn't require much, quite frankly, and Oklahoma does. 30 hours is a lot. So it'd be nice if both of them said 20 and they both renewed on the same year. The problem with Arkansas and Oklahoma is the 2 years are off. So if you, as a matter of fact, I gave up my Arkansas license because I'd done all this education in another year and I didn't have my, it's the hours I needed to renew, so I haven't been licensed in Arkansas in about 5 years.
I think my CPR counts towards 1 year CEUs too, in Arkansas.
Oh, does it? So that would be 1 hour? Okay. Yeah, anything that y'all can do to get your, the nice thing about continuing education is it's a great thing to go and do. You interact with other therapists, it's just good. It's just a good thing and a healthy thing to do. And anything you want to you know, be updated on.
Be careful of stuff you do online. We got a friend that she's a PTA, she did some online out of Mexico. It didn't take, they wouldn't accept all of it.
Accept it. Yeah, you need to get things, anything that's questionable and has not already been approved by the Oklahoma board or the Arkansas board, you need to get it approved before you take it, something like that. A lot of things are already approved. They take care of it themselves. But
If you're like a traveling PTA,
uh-huh.
does it affect like where you're at that particular time?
Yeah, you're gonna have to look at, the thing, let's say you were licensed in 3 or 4 different states and you wanted to keep that going because you travel and you're gonna have to fulfill what their CEUs are in all of those different states. But you can use the same CEUs for it. So if you have to get, trust me, 30 is about the max on what you have to get. So if you get 30, then you can use that in all the other places. But if you have both Arkansas and Oklahoma, you want to make sure you get that 30 in the time, in the middle where it counts in both. See, it'd be nice if they renewed the same year. Arkansas, everybody had to send in their CEUs. They're gonna had to send them in December. Oklahoma, I'll have to send all mine in next December. Does that understand what I'm saying? It's in Arkansas. So.
On the license renewal each year, do they send you something saying it's due, or do you just have to keep track?
Yeah, well, if they happen to miss you and they don't care if you didn't do it, you gotta do it, but they'll normally send you something. Yeah, I get an email, basically, so, yeah. Of course, for revoking or suspending a license, there's all kinds of misconduct that's gonna cause that. Any unprofessional conduct, if you're involved in some kind of criminal activity, of course, they're going to look at you and have to go before the board. So, anything, I mean, I'm trying to think what else, but I do know that that's it. Gross immorality, of course, personal incapacity. There was if you go to work drunk, it's not good. So the board can look at you then and do that. So if you don't, probably they would have you come in and, I mean, they do, Oklahoma really does bring you in. Oh, I know what it was. There was a guy in Oklahoma, he was telling me, that had a speeding ticket in Arkansas that he did not pay that speeding ticket. And Arkansas revoked his PT license and he had to go before the board to get that renewed. But he did not pay it. Keep that in mind. He did not pay a speeding ticket. So that kind of stuff is considered unprofessional, I guess. But anyway, that's the other thing I was thinking of.
If you don't pay your taxes, they'll take them too.
Yes. And as a matter of fact, I've dealt with that. And if you don't pay your taxes, that is showing up on your background check now. So all of these companies all of these places are getting their computers together. So I don't know, we've always, and I'm sure that's true for different states too, but it seems to really be true for all the state run parts
Like
of it.
shoplifting and stuff like that shows up too.
That would be criminal activity, so yeah,
Yeah, and domestic abuse that showed up.
yes.
Not for me, I'm not a wife beater.
Well, I'm just saying domestic abuse, you would have to go in before the board.
I have a friend that did both, and their youth, stupid, and then went and got their RN license, and it took them about 6 more months to get their license.
Yeah,
The only thing that saved them is they could work under a temporary license till they got it.
yeah.
They had no.
And was that in Arkansas?
Mhm.
I'm not sure Oklahoma would have let them work under a temporary license.
Okay, Arkansas.
So if you have anything on your background check, I would get it off there. I mean, I know that's silly, but it
I will
just keeps
say,
you from,
be honest, because I had a couple of friends graduated from here RN, and one lied, said they didn't have anything on the record. One was honest and put it on the record. The honest one, he got his license, took him about 6 months, but he got his license. The one that lied, he got his license, but then when they did all the checks, it come back that he lied, and they lost their license, suspended for a year, and couldn't work.
yeah, they're pretty sticklers for,
Still, he ended up getting his license back, but he went a year of not working as an RN because he lied.
right.
So it's still better to be honest. The one that's honest never missed work. It just took.
Well, you're a medical professional and your work, don't y'all feel like that's a fair thing to be? If someone lied about something in their past that was a criminal, some type of activity that would have gone on a background check, I don't know, it's
And
interesting.
it costs more, the one that was on, because they had, like the shoplifting was way down in Texas when they was like 18, but they had an investigator, had to investigate the allegations, so it cost them more too, and it took
Yeah.
about 6 months.
Well, everything has to be completely cleared off for sure, but that kind of thing, I would want off my background check, but you can have it expunged because it's been so many years if you've stayed out of trouble, and it would be worth it to do that, because every time now, background checks are done yearly on employees, and so
Well, it had been expunged, but when you apply for it, it asks you if you've ever been arrested for stuff.
okay,
And so he was honest and put it on there, yes.
okay, I
See,
see,
the other one put on there, no, never been arrested,
okay.
even though it'd been expunged.
Oh, my
Well, it
goodness,
still showed up they'd been arrested, even though it'd been
Yeah.
expunged later on
Yeah.
or whatever. Yeah, he lost his license for a year.
Uh,
And so he was working in a hospital, lost his license, so he had to quit or whatever,
Mhm.
got fired.
well, did they rehire him a year later, would be interesting to
I
know.
don't know, about that.
Well,
Went to work
the
somewhere
sad
else. I
thing
think
is, if you're
embarrassment
willing to
getting
be
back here.
lie about something like that, what kind of ethical,
His defense was he thought, well, it's expunged, so he thought it wouldn't show up, but it still shows up he's been arrested.
okay. Practicing medicine without a license, probably the biggest thing that I hope y'all know is that only a doctor can give lab results or any kind of results. So if you're in the hospital and they put some results in the test area, you do not want to say anything if they ask you anything. If you saw that their cancer had returned, if you see anything, you want to not open your mouth about anything like that. Because the doctor has to be the one that tells them those things. And I just be aware of that. You don't ever want to be the bearer of good or bad news. That's the doctor's business, and he's the one, if he orders the test, then he's the one that's supposed to talk to them about the test.
Even if it's just like blood pressure and like anything.
Oh, no, you can report blood pressures, and if there's a test, though, like any kind of blood test that shows that he wants to talk to them about that. He doesn't want you even talking about them being, let's say their hemoglobin is low. If they hadn't had time to report to them those things, then he wants to.
Can a doctor give a nurse the authority to do that?
Yes, I don't think they're really supposed to do that, but I find that they're doing that more and
When I
more.
worked at the doctor's office, they did that a lot.
Okay, so it must be that they're able to, because they're not gonna take a chance with their license. I think doctors used to be more about doing that. I think they should be able to let the
Yeah.
nurse do that. They've gotta have some help. They've got too much going on. They don't have time to do all that, but.
But what about if you are, in an inpatient setting and you, have a chart and you see that their hemoglobin was low and you know there's certain things that you can't do with them, but you don't know if the doctor has actually spoken with them or not about that?
You know why? I would probably err on the side of caution, especially if you don't know the doctors. The problem, why this has ever gotten out of hand is you have doctors that sometimes think a lot of themselves, and they react, and so you are in the wrong if you do that. And I mean, that's the rule. And, but really, in that particular instance, you'd think, well, you're not supposed to treat them.
Yeah.
So, I just would say, we need to wait until, have you seen your doctor today? Ask them that. Because a lot of times the doctors are there in the morning.
Yeah.
You could even say, has he talked to you about your blood work? Or something like that. That would be okay. It's not a secret, but.
Is that more
you
acute
can-
care, what you're talking about?
Pretty much, yes, yeah. Because that's about the only time that it would affect too much. Maybe in the nursing home, but not too often, really. I mean, really, doctors are in the nursing home,
You
once
ever
every
heard of
2
somebody getting
months.
a steroid shot and their blood sugar shooting real high, like?
That's
super high?
common. Steroids will always make the blood sugar shoot up.
Okay, we had a guy, he was like at the fainting stage and stuff from it, getting dizzy and stuff.
Yeah.
It was like, he got a steroid shot 2 days earlier.
Yeah. Steroids are really scary. You have to be careful with
They
those.
said
Change personalities, they do all kinds of things.
that it actually breaks down the muscle or whatever, and
Yes.
it puts like the blood sugar into the system from it.
Yeah. Remember, blood sugars go crazy also with surgeries. Almost always and it's become more standard to put people on insulin now as soon as they get in the hospital. Have y'all had experience with that with some of your old people or anything? A lot of times they'll immediately put them on insulin because when they're under stress like that or they're very sick, but especially if they have knee surgery or something, and the crazy thing is nobody tells them that. They'll come out of the hospital, their blood sugar's running 200, it's never run over 110. They're scared. No one said, oh, by the way, that becomes me. I do a lot of medicine education. Why does the nurse not cover that with them?
My granny's blood pressure was high
Yes, and
when
that's
she
pretty.
had surgery, but she was nervous.
Well, and what happens too is, remember that if someone with surgery, who loses weight with surgery? Males or females? Males. So they almost have to always have a change in their blood pressure medicine. Who sometimes gains weight with surgery? Females. So anytime you have that that's why you need to always take blood pressures, by the way, right after someone's had surgery. And I realize people don't do that much in outpatient areas, but it's really wise to do that. I've learned that, because I do it all the time now in home health, and just to cover yourself. But blood sugars and blood pressures are gonna kind of go haywire after surgery for a while. And sometimes they drop, because again, people have lost weight, or they're eating differently, and all those different things.
Because you know that their blood pressure is gonna be a little off,
what would you then set as the standard of working out?
I would still, if it's 100, I probably would not treat them. I mean, I would, and sometimes remember when you start working them out, their their bottom number will drop. Yeah, I mean, if the bottom number's 100. You know, when we did Don the other day, his bottom number was 100, so we need to monitor him. Who's working with him tomorrow? We definitely need to do vital signs to start with, because if it's still 100, we're gonna send him to his doctor. We're gonna encourage him to go to his doctor. But again, you're looking at someone who's losing weight. He looks 30 pounds lighter to me than when I saw him 6 weeks ago. He's not any lighter, but he's much more muscle than he was, which is kind of interesting, isn't it? How much, when he gets to where he's walking on that leg all the time, if he wears it all day long, he won't have to exercise to lose weight. He won't. He'll be thin. It takes a lot of energy to use an above knee prosthesis. So he'll lose weight, if anything. So I hope, I'm pretty sure that's what's gonna happen with him. As he starts wearing it all the time and doing this, I think he'll continue to drop weight and be stronger, right? But anyway, I was hesitant to treat him on last week, but we monitored him and it was, what was it, Chris, that second time? Was it still 100 when we took it at the end? So that's too high, really, to work him. So, yeah, but he's been, what happens is people think they can overcome the blood pressure thing. And remember our little Hispanic lady that we're working with is she's 33 years old. So she's very young stroke. And I do not know if I don't know what happened with her. She had an aneurysm or what. I'm just assuming it was blood pressure. So I don't think they even know, because I don't think they were watching her blood pressure before she had the stroke. So we had speech therapy on Thursday at 4 o'clock with her, and it was good. She was very excited about it. The speech therapist did tell me that she's pretty severe. She's not sure how much she'll get back. Her yes and no's are not always correct. She's actually understanding a lot less than we think she is. So as you work with her, she's very good at picking up on voice inflection and that kind of thing. So anyway, it was good. On the JCH accreditation, this is the Joint Commission of Accreditation of Healthcare Organizations. No one went through this while they were on their clinical, did you?
Is that the JCO thing?
Yes.
I did.
How was that?
Well, they came there. I don't think that they came in there while I was there. They didn't talk to me
Okay.
or anything.
Yeah, it's JCAHO
But
is
it was
always,
just like state coming to the nursing home.
Yes.
Everybody was running around
Yes.
and getting all crazy and
That's the only time
excited.
anyone's
And,
ever in compliance is when they're there, when they're gone, they're still there.
yeah,
Yeah.
it's just a fun thing to be a part of.
everybody was really stressed out about it.
JCAHO does hospitals, long-term care facilities, they'll do clinical labs, they'll do outpatient clinics, but I rarely see outpatient clinics doing that. So, anyway, there's also, for rehabilitation centers, there's another, it's CARF, Commission of Rehabilitation, facilities, I think. But I haven't heard about CARF in this area at all. In New Mexico, they accredit all of the rehab facilities. We talked about what a standard of care is, and that's basically ordinary skill and care that a medical practitioner must use. It's what is used commonly in that area by other PTAs in that area. So that's a standard of care of how other PTAs do that. The other thing is, this is not so on the physician-patient relationship versus the PT-patient relationship. Once they are accepted into your clinic, you have that relationship to them. And so that's already established, but that's actually more of an issue with the PT than you guys. I don't think they could sue you for a breach of that relationship, because the PT would make that decision if you decided not to treat someone again. But if you did decide not to treat someone, you have to write them a letter, and you have to offer them other areas that they can go for treatment. And what would be a reason that you might not treat someone? Compliance. They've gone out and done crazy things, especially like a surgical situation where you know that they're overusing a brand-new rotator cuff type thing. How long does a brand-new rotator cuff usually sit still with no range of motion? Sometimes 2 weeks. I just have one that had a repair of the subscapularis and of the biceps tendon. She was still for 6 weeks in a immobilizer for 6 weeks. And she really has pretty good range of motion. I was shocked. But, you know, they have to do that. So if they're not in compliance and you feel like they're not, then you might possibly decide not to treat that patient, right? Or you're gonna do everything you can to keep them. You're gonna call the doctor, you're gonna get onto them, you're gonna do all those things. But let's say they're a drunk or they're an alcoholic and you know it's not good and you really feel like that's not good. Another reason is, what if someone comes into your clinic under the influence of alcohol or drugs or something like that? What's the thing that you can do with those people more than anything else that you have to be careful? You can burn them. So for sure, you do not want to do any kind of hot packs with those, ice packs. You're not gonna do any kind of electrical stim. They're much more prone to burns. And so, you probably shouldn't treat them, right? I mean, if they've been drinking and you're just, you know, you really should just look at that and decide what, that's another
I got a
time that you
question
might
for
not treat
being
them.
responsible or liable, or, like, we had a vertigo patient,
Uh-huh.
and she literally had to have assistance to walk from her car to the treatment and then back to her car,
Uh-huh.
but then she'd get in her car and drive off.
Woo-hoo.
How responsible would you be for a situation like
They
that?
could hold you responsible for that.
Well, great.
Not you, but the facility there.
She couldn't walk to me to you, I mean, she was terrible.
But what
But she
did you
was trying-
do? Cause she drove herself there.
Well, she's one I might not treat. I don't know what I would do. I probably would, I mean, was she safe sitting in a car? Was she still did she have
She
vertigo?
couldn't sit up straight like me here right now, she'd lose her balance.
And she was driving a car?
Yeah, Toel or RAV4 or whatever,
No,
why?
I would have asked her to call somebody to come, or I might have taken her home myself in Port Oklahoma. I'm not
Pretty
sure of course,
sassy,
man.
so, good luck.
Well, I probably would not treat her again. I mean, you have to realize you are
'Cause
liable.
she had eye issues too, she was going to an eye clinic to get treated for.
She shouldn't have been driving.
Oh, no,
They
no.
should have reacted on that. I'm not putting them down, I'm just saying, that is one that you really, I mean, if someone has been drinking, you don't wanna let them go get back in their truck. I mean, you know what, that's, I don't know that, it is a legal issue, because, you know, a bartender is now responsible for which I
It
disagree
just
with,
crossed my mind when I had to walk her
but,
to the car.
A bartender's
And I realized-
responsible
For over-serving.
if someone wants to get in a car and they've been drinking, I would call the police. Yeah, I would call the police in that instance.
I had to, like, testify for something this summer, or this last summer, because I bartended and this guy got too drunk. And I was like, he must have done something beforehand, because he was fine when I was serving him. So, but I had to like talk to an attorney and stuff, because there was a fight in the bathroom. And so somebody was suing somebody, and
So,
it was insane.
did y'all get blamed for the guy who was drinking too much? For that, in that situation?
Yeah, I was the bartender that night, and so I had to give my statement of,
can't
well, how many drinks I
Right. Oh, I
I
can
served
see,
him and
yeah.
everything, like.
But I couldn't see how you could be held responsible for someone getting in a fight, because they're gonna get in a fight sometimes whether they're drunk or not.
Oh, yeah.
You know, I don't know.
That's-
Interesting. Anyway, liability is kind of a weird deal, and you only do the best you can to protect
That's not
yourself.
true.
Because some people are just out to get you. I'm just telling you. From the very beginning, they're out to get you. They just want to sue somebody. So I don't know.
What about that lady that, like he was saying, would you call the cops in that situation, or would they be able to do anything?
I really wish that they had reacted.
You'd got a good cussing if you'd told her she didn't need to be driving, just let me know ahead of
I
time.
tell you what, though, if she'd gone out and killed your daughter,
Right.
and you think that she might not have in some, I mean, man,
I
you're in
just
a
don't
very
know.
busy place to, I'm just saying in that situation, I probably would react.
Cause I went in there at the end, cause I was treating a patient, and like, she couldn't stand and walk without help. And so they asked me if I'd walk her to her car, and I said, sure. And I said, you don't have a good Christmas? She goes, hell no. Okay. And
Well, I don't know what, maybe some that feel safer about her driving. I'm not judging them for that. I'm
Right.
just saying with what you've told me, I probably would not let her drive home. And I wouldn't want her to drive back that
Cause they
way.
was doing like balance exercises and then eye exercises, you
Yeah,
know,
all the
deal, so-
vestibular stuff, but
Yeah.
yeah, she didn't need to be driving.
No, I didn't think so.
Yeah, no, that's, you know, that's a scary thing.
I loaded her up, said Merry Christmas.
Yeah. And obviously she made it home, and let's say 85% of them do make it home, don't they? But what about those 15% that, you know, I
I'm
mean,
just
think,
glad it's like 1 o'clock and I get off about 5:30.
don't we wish that one of Don's, you know, that Don's guy would've had someone that took the time to take his keys away? They would've saved Don's all of this, what he's dealing with. So,
You know, that's ironic, we just seen him, and on TV, I seen where a guy lost his arm and a leg, where a lady in an SUV T-boned him and his wife.
in his car,
No, he was riding a motorcycle,
motorcycle.
but he was still riding. He had a stick shift, and he had like a hook where he grabbed it.
That's really Don's goal. He would really like to get on a two-wheeler and do it
Oh,
again. There
absolutely.
are some above-knee amputees that do that,
I don't know.
because he's been in contact with them, but I'm not sure. He's a little more realistic about whether he can, well, he got on it, remember, he got on one and he had trouble just holding it up.
But it's early for him.
Oh, yeah.
I got a
I
friend
think
that
he's gonna
rides.
get a lot
I got a friend that
stronger.
rides, but his amputation's below the knee, and he rides.
But below the knee and above the
I
knee
know
are
it's a big
two
difference.
different things, yeah.
His is below the knee, and it's tipped over on him a few times. but
Yeah,
It is
yeah.
what it is.
Well, they have to make their decision to do that. You guys who are gonna work with them tomorrow, y'all need to come see me just so we can kinda, cause Don comes in ready to work and he needs you to be ready to go. Cause he wants to come in and work an hour and be gone. And, I will try and be here at 7:30, so I'll have the door open. I was here right at 8 o'clock.
He was here at 7:40.
Was he? Okay, I'll be here at 7:30, I can do that.
I wouldn't make
Y'all don't have to be, but I will be. Just be here by 8, ready to take blood pressure and put him to work. So we're gonna kind of talk about what we did, anyway, okay? Prudent person rule. This came out, and it's been many years ago, where they started requiring that you give information to the patient and give them all the pluses and negatives of having surgery or whatever. They do done in their initial information packet where they sign up, and it really is useless because no one sits down and says, okay, these are the risks of what we're gonna do, you may fall. You know, even in, when you're having surgery, they've gotten so used to just saying it now that I'm not sure that it's as effective. Legally, they're covered, right, when they come in and tell you what can happen to you when you have, and your anesthesiologist always comes in and talks to you now. That's a new thing that happened after this went into effect.
I have a question. Like, when I was in Lena, they had, every week, they talked to each patient and had them sign like a paper saying that they talked to them about each thing or whatever.
About their lives.
Is that what that is?
I think probably so, and something came up with JCAHO, or they wouldn't have done that, but it's a good idea. Really, whenever you reevaluate, what normally you would have a team meeting with the patient and their family in rehab, but now they're out of rehab in 2 weeks. So sometimes that's really changed. And so it's nice for them to know what your goals are, how long that you think they're gonna stay, especially now, because they don't keep them again but 2 weeks. And so it's just nice to say up front, okay, we're only gonna get 2 weeks with you, and this is where we think you'll be at that time. Our goal is that you're able to transfer by yourself, but you're still gonna have a lot of therapy at home for walking or whatever.
Mhm.
So I think that's a great thing, and it probably was part of this. Something happened where they had to do that. Also success and failure rate for the procedure. And of course, we're not doing that kind of stuff, but probably the amount of expected pain. Hopefully, we don't give them a lot of pain, although they expect us to. They've been told horrible things about physical therapy.
What did Don call us? Physical terrorists?
Yeah, yeah.
That's actually not funny.
Trust me, I know he didn't give you any pain. So, and you're getting a lot of HIPAA stuff on this. Just be really careful what you say about your patients, you know, especially in the facility, but even at home, it's probably better not to talk about your patients too much. And this all came out, your HIPAA all came out surrounding AIDS. That was really the big thing, because people were finding out that people had AIDS or were HIV positive and they were losing their jobs over. And that was probably in probably about 85 or 86, all the HIPAA stuff started coming out. The other thing that did come out that was good about that is they started requiring, part of this was the gloves and everybody wearing gloves and being very careful around any bodily fluids and stuff like that. They have certain procedures to wipe up blood if someone bleeds and that kind of thing. Statute of limitations, basically it's the period of time that a patient has to file a lawsuit, and it is very different in different states. It can be based on the discovery rule. If someone, when they discovered some issues, sometimes with the child, that will be down the road. Kids actually are about 18 years, by the way. If something happened, they can still sue for something that happened at birth for 18 years. That's why doctors' offices keep records that long for pediatrics. But it's usually 1 to 3 years on the statute of limitations in most states. And that's even less than it used to be. It used to be 3 to 5 years, I remember that, but it seems to be less. On the Good Samaritan laws, it pays to know what your law is in the state. Do y'all have the skills to help somebody in an emergency situation? Probably a little more, would you stop? Yeah. Interestingly enough, we had a student about 3 years ago that came upon a patient just like Dawn, and the guy had been in a motorcycle wreck, and right behind her were 2 emergency room nurses. It was kind of like the same thing with Dawn. Those nurses, even this student wasn't supposed to be on that road that day, and the nurses for sure weren't. They just decided, it was 71 up to Fayetteville, and people don't normally take that unless they have a lot of time anymore. And they were both on that road not really meaning to be there, and they saved that guy's life, and because he also had an amputation after he was hit. So, but anyway, basically, Good Samaritan laws, if you do something that causes harm to a patient when you're trying to save their lives and you stopped at a situation, then you're not going to be held liable for it. But a lot of doctors won't stop because they are so afraid of liability, and that's why they had to put these into place. I think it's interesting that in the state of Vermont, if you don't stop, and they find out that you passed by an emergency, then you can be in trouble. There is no legal obligation actually to help, but there is an ethical one, as you would want someone to help stop for you if you were in that situation. So
During my clinical, the director of the PT, Andy at Sparks, came on and an accident was like right behind him, and he had to give chest compressions
oh wow,
to save the person's life
wow.
until the ambulance got there.
And he's a speech language pathologist.
Yeah.
So he was trained in CPR, so that's neat. He's a nice guy, so he stopped because he's that kind of a person. Respondent superior is a Latin term, and basically it means let the master answer. And this is where if you guys get sued, then they can go after the PT, they can go after the doctor, they can go after to the facility that you work in. And so that's kind of what that is that they are responsible for you, and particularly your PT is responsible for you. So that's why you need to really have a good relationship with your physical therapist that you work for. And I haven't seen a lot of problems and issues with that. I have only had one PTA that's worked for me before that I would not ever work with again. And it was actually there's 2 of them. One, I just couldn't trust her to do what she was telling me she was doing. And it became an issue with me. And I don't have time to babysit. And so I have to have people who can treat patients and tell me what I need to know at that time. And most of your PTs do expect that from you once you're trained. That's why it's very important your first 2 years that you're really not going to home health if you can help it. It'd be better to go and at least go into a home health setting where you have a lot of people to bounce stuff off of. Because people look at you as a novice for about a year or 2 years, but once you've been out, if you go and do home health for 5 years, and then you want to go into acute care, they really need you to come in ready to do it, right? So look at, you know, if you have an opportunity, sometimes that may not be possible for you, but that, people look at you as a novice for about 2 years, and if you can just think, I've got to learn everything I possibly can to be the very best PTA that I can be, it's really important to do that. And that's why it's not always advisable to go into home health so soon, but at this point with jobs being what they are, you may have to do that. But remember to call people if you have questions, to learn everything you can. You can always call me even 20 years down the line, right? And hopefully I'll have an answer for you. And then they talked about the employee's duty to carry out orders. Of course, you have a duty to carry out an order by your employee or your PT, but you always have the right to question, right? So always question something that you don't feel is good, especially because you need to cover your PT's butt. They just need you, sometimes things are questionable and they missed it. So don't just do anything, always question if you don't think that sounds right. Doing an ultrasound on someone that you found out was pregnant, doing an ultrasound on someone that's had cancer that they missed it. You know, you always ask that in the initial eval. But patients certainly don't know that you're not supposed to do ultrasound over a cancer site, right? So those are the things that you always question. And around here, you don't want to miss that someone has diabetes, right? That is a big issue in this area. Scope of practice. Employee in a medical setting must clearly understand and work within the scope of practice for his or her discipline, and that's again the standard of care and what your scope of practice is. What is the main thing for your scope of practice? Is it time to go?
Don't kill anything.
No. Am I almost done?
Yes, don't kill
Oh, I have 2 more, Bill, wait 1 second. Mainly is that you always work under the supervision of a PT, right? Right. Healthcare workers have a duty to be assertive and question those orders. We just talked about that. And all employees must understand that there are limits to their authority when it comes to healthcare decisions. So again, the physician always has the right to make that decision. And then y'all can read about risk management. And everybody's a part of risk management, right? I guess that's what I'm saying.
Yeah.
Take 5, yeah.